My name is Nina. I live in Gibraltar. I've been here a fair while. I had the opportunity to go abroad with my son, and I found that my knees were just getting worse and worse and worse and worse. And it wasn't until I'd been on that holiday that I realised that maybe I should do something, and come and see a consultant about it. Luckily, this Gib is a small place. I got to see Dr. Thomas Boerger, and it was the best thing that I ever did. The doctor initially that I went to see thought that I'd torn a meniscus, and then suggested that I go and see Dr. Boerger. And when I went to see him, he said, "Look, I think it's a little bit more. I think we need to get some X-rays." Um, and I was quite miffed because I thought it was going to be something simple, to be fair, and a little bit distraught that it might be a lot more, obviously. But at the end of the day, it needed doing. So I got the X-rays, nice and simple in Gib. You can get them done in two places, and it's so easy now. And he looked at the X-rays, and he immediately knew what he was looking at. He knew exactly which X-rays. He gave me a list of the type of X-rays that I needed, and having looked at those, he was straight away of the impression that I needed a total knee replacement, which again, like I said, was a bit of a shock. But once the penny had dropped and in the realization of what I needed, it was going to be done, and that's all there was to it. It was going to get done. When I got to speak to him, once he was looking at the X-rays, I then became very interested in exactly what needed to be done. I wanted to know everything. I wanted to know how long I was going to be in hospital, how long it would be before I'd start walking again, exactly what they were going to do, what the actual implant was going to be. And Dr. Boerger gave me everything I needed to know. He answered all of my questions, and believe me, there were a lot. He answered all of them in layman's terms. It wasn't all technical, and he was very straightforward. There was no, oh God, she's asking another question. There was never any of that. It was just, no, she wants to know. And I think he was he quite enjoyed the fact that I wanted to know. He was very proud of what he does, obviously, and he's very good at what he does. And he was very clear of everything that was going to happen, everything from, how long I'd be in, the procedure, the anesthesia, everything. He was just so clear. I loved it. It was me. And then I went home and I did some research online. And everything he was telling me was spot on, absolutely spot on. Because I'd asked all the questions, because I knew that, well, everything I asked, I knew how long I was going to be in hospital for. I knew how soon I was going to be walking. I asked, how long could I walk for, because it's, you don't want to overdo it. And he was telling me absolutely everything. And so it was important to me that I knew, so that I could stick to what he'd asked me to do. And with the physio, again, it's exactly the same. They tell you what to do when you do it, and it does work. They know what they're talking about, all of them. Dr. Boerger, Tanya, the physiotherapist, Gabrielle, amazing people. They're so calm. More like a holiday place than a hospital. You feel so calm and relaxed, and it's so quiet. Perfect place for a recovery. I had a beautiful room with a beautiful view. So that helped in my mental recovery as much as my physical recovery. Moving around the hospital was easy. Plenty of lifts, practice for stairs. Thank you, Gabrielle. And once I'd come out, the expectation was that I could do a little bit and a little bit more each day. And I knew from the first knee what I was doing, with the second knee. But even with the first knee, I had an expectation of what I could get around, how I could get, because I live in a place that has stairs. So that I had to go up and down stairs, which is brilliant because it helps even more so the recovery. People think, oh, maybe I don't do anything and then it'll get better. But no, you do need to move. And having that knowledge that I did need to know that was important to me. like I said, I needed to know everything. So I wanted to be sure that I was doing the right thing. Before, it was a case of I didn't want to go out. Or if I went out, I made sure that there was somebody with me, because I was afraid that I might fall, or I might get to a situation where that I couldn't get home, or I was stuck, or just in too much pain that I couldn't cope with it. So I wasn't going out much. I would go to work and that was it. Now, well, now I've joined one of the clubs in Jib that I never thought I would. I'm meeting more people. I'm getting out more. I go shopping on my own. My life has just opened up, and I feel my mental health has improved. I feel so much better. Yes, I still get a little bit of pain now and again, but certainly manageable. And I feel that my life has expanded. It was such a small little bubble, and now I'm not afraid to go out. I can go out on my own. I'm enjoying the life that I have here. It's wonderful. Big difference.